I got interested in the LANAP protocol after talking to one of my good friends who's also a periodontist, and he had been using it for, I think, since 2007, and thought it was really, really good, and he was happy he started it in his practice. So I was trained with him. He was a year behind me in my residency, and I respected him, so I jumped on board. Since I started LANAP, my patients have been, the case presentation acceptance rate has skyrocketed. They're very interested, and cost doesn't seem to be as much as a factor as it did when I was doing traditional periodontal surgical treatment. They've always wanted to get the treatment, but they used to say they'd throw cost in, but now they're more relaxed about it, and cost does not seem to come up nearly as much. But the most noteworthy patient I've worked on was my very first LANAP case. Was full mouth, every tooth was class 3 mobility, super heavy calculus. With traditional periodontal treatment, I would have recommended full mouth extraction, but I thought I'll try this on him. He was a mid-30s Asian descent, so shorter roots, long root trunks. So I'm like, well, let's try this treatment, and he went for it, and it sold me. He's no mobility now. We even kept his wisdom teeth, third molars, and he's happy. I'm happy, and I've had one of my better friends that was a perio resident, also a year behind me, and she called me about 6 months after I started using them, and wanted to know what I thought, and I said, "Get it, Erin," and so she did, and we've been talking a little bit, and she's happy that she did it.